Hello, my name is Brittany Matson. I am a radiologic technologist at the University of Utah Hospital. A typical day for me is where I go into the department. I see where I'm scheduled, and that could be fluoroscopy, which does lumbar punctures, MBS with speech therapists, or esophagograms. They can see if there's any obstruction in your bowel. So it kind of depends on the case. I could also be scheduled in spine or pain clinic, which inserts needles around a nerve ending, and then they release medication. So patients get pain relief. And then I could also be scheduled in GI lab, which puts stents in, or they will take things out like polyps. So that all depends on the case as well and what I'm doing. And if I'm not scheduled in one of those areas, then I will be in regular diagnostic x-ray. That is, I guess I should say, a typical day for me in that one is where I go to a computer. I see if there's any inpatients or outpatients that need to be done, if I can bring anyone down to our department. So people who just get their hardware placed in their spines, or they have a new knee, or whatever it could be, we would bring them down to our department and we would image the patient, more or less standing for any spines. And so I interact with doctors, nurses, PT, and I ensure that the safety of the patient is there so we can actually do and perform the imaging that's required of them. I also could do anything from an emergency for an outpatient, or something that's pretty standard and typical as you age, arthritis. And so we do lots of imaging for arthritis for outpatients. You could have a trauma come in, and that could be something that I do mostly for about 2 hours because they're usually very long. They usually require a lot of different imaging, and you have to be fast and think through your imaging really quickly. So it's kind of fun to sit there and think on your feet, and creatively as well, because you have to use a lot of different objects in order to prop them different ways, or ways that you're thinking about your angle, because lots goes into an image, because you can distort a lot of things too, and so it can throw off the diagnostic quality for the radiologists that are reading it. If I'm not doing something like that in the department, I'm going out on portables, which I could be x-raying a chest for chest tubes, lines, liquid, anything that's like a pleural effusion, or abdomens for NG tubes or for obstruction. Sometimes we'll give them contrast, which shows up better in the image, and then we can see how their gut is doing and where it's going, and if there's an obstruction that way. Or I'll go off and I'll do a critical patient who can't come down to the department, and I will x-ray hands, knees, shoulders, clavicles, could be anything. So it really just depends. We also do newborn ICUs, so we will go down there and do a lot of line placement views for them, or seeing how they're doing with their skulls sometimes. Sometimes they get edema, and so you have to see what's going on. So we'll do bone surveys, anything like that. So it's very interesting. Yeah, so that's a typical day for me. And then as far as why did you go into this field? I went into this field because it offered a lot of different variety of things throughout my day. I like that I mix it up. I like that I see a lot of different types of patients, anyone from being very grumpy or angry or happy to sad. I like the variety, keeps me engaged a little bit more. I don't have to necessarily be with someone for about 12 hours in my shift. I can actually vary the type of environment that I'm in, and I thought that was really important to me as far as a career. Yeah. So, and I guess the specialty within X-ray was very important as well, because you could specialize in CT, MRI, ecotech, radiation therapy, nuke med. So lots of different ways to get more education, more money, and more variety in your day, and different jobs that you can do. So advancing my career was also very important. And what schooling did I have to do? I had 5 semesters, so 2 years of schooling. I had to do 1,500 clinical hours, which is 3 days a week, 8-hour shifts at the hospital, and then I would go to school on top of that. So long, but worth it. You get your working associates through it, and yeah, but the reward is that you can specialize, sorry, my cat, easily in it if you'd like, and expand your career faster than you can in other areas of the medical field. So that was important. What is your favorite part of your job? The variety. Absolutely. I like the fact that I can do a lot of different things throughout my day. I like that I interact with a lot of different types of patients throughout my day. I like having to think on my feet, so I like working at a Trauma 1 level hospital. The rush of trying to get it done when you're under pressure is kind of exhilarating, especially when you do it well. Really upsetting when you don't, but kind of cool. So I enjoy the job that I have because it makes me think in a different way that I normally wouldn't have before, because you have a lot of factors now with imaging and technology that is part of your job that you have to think about as well. So